Amid a lifeguard shortage this summer, medical professionals are urging parents to keep an extra watchful eye on the young ones in the pool. According to the American Lifeguard Association, about a third of the 309,000 parks and pools all across the country will not be able to open without enough lifeguards. That's now leaving some public pools in the Charlotte area closed and some neighborhood pools left unstaffed. WCNC Charlotte's Kendall Morris takes a closer look at the signs of a drowning.
A splash in the pool is the perfect way to beat the summer heat. But this year, that dip under the water can be especially dangerous if no one is watching.
Always make sure that your children, if they are young swimmers and early swimmers, have an adult in arm's length by them in the pool.
According to the CDC, there are an average of 11 drowning deaths and 22 non-fatal drownings per day in the U.S. Officials say a 5-year-old was found unresponsive in the water at Monroe Aquatics and Fitness Center Thursday and was taken to the hospital in critical condition. There were 8 lifeguards on duty with 105 people at the water park. Doctors still recommending designating 1 adult watcher per child, with lifeguards busy watching multiple people.
If they are good swimmers and or are older swimmers and don't need that kind of help, they still need to have 1 designated person watching them at all given times.
Doctors say oftentimes there's no scream for help or splashing with drownings. They're silent.
In most cases, you don't see a struggle. You just see somebody under the water or floating face down.
There are only a few seconds to notice the signs. A drowning person doesn't wave their arms because they instinctively push down to try to get above water. And if a child is noticeably silent, it's a red flag. Doctors recommend having someone on hand who can start CPR right away if a child goes under.
CPR at site has shown to be, over the years, proved scientifically to have a much better outcome when these kids come to the emergency department than kids who did not receive CPR at site or good, adequate CPR.
Experts saying constant supervision is key in keeping kids safe this summer. Kendall Morris, WCNC Charlotte.